That's where you are right now. 95.9 WATD with Rob and Beth. We're going to be with you till 10 o'clock. Right now, it's time to check in with the doctor. Dr. John Hayes joins us in the studio every week at this time. For a better experience at the doctor's office, try Dr. John Hayes' new, highly personalized and affordable direct primary care practice. Find out more at drjohnhayesjr.com. Dr. Hayes, good morning.
Rob, good morning. Good morning, Beth.
Good morning, doctor. I'm a little bashful because my half-eaten donut is laying between us, and I really wanted to finish off my evidence before the doctor came in.
Well, go for it. We'll let you walk around to burn it off. So.
Yes, thank you, doctor. I'm feeling embarrassed. He's always talking about healthy diets.
Okay, well,
I know. It's just a smaller donut.
I got it for free.
There you go.
It's not my fault.
Right.
I know.
Well, I just introduced Dr. John Hayes, and I read the line there: for a better experience at the doctor's office, try Dr. John Hayes. So what is it like to be a patient in his direct primary care practice?
It's way different, Rob. And I want to start off by just thanking everybody who listens to this and those who become patients in our practice. We really, really appreciate it. And it's simply because they understand what we do.
Yep.
So that's what
we're spreading.
Yeah, exactly. So, it's direct primary care is totally different than traditional health care for a number of reasons. It's been around for a while, but currently there's still only 2,300 direct primary care physicians in the entire country.
Wow.
Out of all of medicine, less than 1% of physicians are independent, which is one of the reasons that healthcare has become the show that it currently is for too many patients.
Yeah.
So in direct primary care, it's totally different. We are self-employed, usually. That's changing in some circles, which I'm not necessarily a fan of at all. But being self-employed, I'm not in a corporate practice, so there's no corporate oversight telling me I have 15 minutes with a patient. You're never being told, you can only have one complaint today with the doctor. And other stipulations are, we can't order that test, we can't do this, we can't do that, blah, blah, blah. There's none of that in our practice at all. Because as the physician, I call the shots. If I think you need something, or it should be done, even if it's not covered by insurance, I'll tell you. If I can advocate for you and have insurance, help insurance pay for certain things, we certainly do that all the time. But the biggest difference is the access to care is dramatically different. So, a perfect example, the last couple of weeks, sunburn, tick bites, flu, still in kids, you name it, all over the place. And so in our practice, like many primary care physicians, we still see patients, same day if they're urgent and that type of thing. But I guess the biggest thing to understand is that you always have a choice. Like I tell patients all the time when they join the practice, I said, look, I'm here to help you achieve your health goals. I'm not here to be a pain in the butt. You tell me what you'd like to accomplish, and I'll do my best to help you. That's basically it. And I've got patients that will say, look, I only want to come when I need to, but I have a lot of patients with much more significant health problems that I see very, very, very often, especially in the beginning of the care. And as they get better, since we've been doing this, we're actually coming up on our second year in September of doing this. It's been extremely gratifying. The practice is pretty well filled up.
Wow.
Yeah, no, that's great.
Yep. Now, as far as being able to connect with you, is it really true that people can text or call you?
Yeah, exactly. So the best way for to contact us is email. If it's non-urgent, we tell patients all the time, email is the best because there are, as you guys know, text outages, that type of thing, especially for things that are non-urgent. Shoot us an email. But if you need us today or you have a question that's urgent and or you'd like to speak to us for the first time, shoot us a text. You can also open a chat on our website. My staff checks in with that several times a day. Regular business hours on Monday through Thursday, full days, and Friday mornings early by appointment.
Yeah, thank you so much, Dr. John Hayes. I can't attest to other direct primary cares, and, I have my own experience with healthcare and my own doctors, but I can attest to the fact that you as a person, you seem extremely caring. I've loved getting to know you. I would love to have you as a doctor just because I feel as if you look at the entire picture as a whole, and I think healthcare now is like kind of pigeonholing into trying to treat one thing, and it could be possibly connected to a larger matter that's not being looked at. And also, you always discuss cutting-edge technology that you're trying to implement, and these are just very unique and special things that I think people can get from your office.
Right, and we can do all that stuff in the office. One of the things we talk, actually two things, speaking of technology, we now have the Smart Heart. We actually have had the Smart Heart EKG system for quite some time, which allows us to do EKGs very rapidly. And if there's a concern and we need a cardiology consult, we can get it within 30 minutes and cost the patient, take a guess, $35.
What? No,
Yeah.
I'm sorry.
Yeah.
$35. It's $35 to come in the door, right? Just to even stand.
No, so if you're currently a patient, there's no charge to come in because you paid your monthly fee.
Okay.
But if you need an EKG, we don't charge for regular EKGs. But if the EKG shows something concerning, you can get a cardiology consult within 30 minutes for $35.
Oh my goodness, that's amazing.
It is amazing.
That's life-saving care.
It is, actually. It quite frankly is.
Yeah.
The other thing that we've just put in place, and we're going to start to do in June in our practice, is much more dermatology.
Cool.
We just purchased what's called a dermasensor. Now, the dermasensor is a very, very interesting device. It's actually powered by AI. It's been around for a while. It's been used in the Mayo Clinic and other very, very large health centers, and it is over 90% accurate when we use it on suspicious skin lesions of helping us differentiate potentially malignant versus benign lesions, especially melanoma or dark skin type lesions.
Wow.
That's a game changer.
That is, because we've learned getting on melanoma right away in those early stages.
Exactly. And the technology is fantastic. It's been very, very well tested. So we've put that in our practice now, too.
Also life-saving care.
Well, totally. And so I have some awesome employees. I really, really do.
Yeah.
But we're going to be opening that up primarily on Friday mornings by appointment.
Cool.
Yep.
Okay.
So another really
that's
good tool to have.
To look forward to.
Yeah. So this is a nice thing about my practice. I mean, I choose what I want to do largely because patients ask me what they need, what they want, and that type of thing.
But that's so great that you rise to their needs. You know what I mean?
We do the best we can.
Yeah.
That's all. And there's so much. There's so much going on now in the whole AI world, but I have to say, we talked about this before. It's called artificial for a reason, but it's a game changer.
Totally,
it's a game changer when it comes to medical research and possible underlying genetic disorders. Now there's much more AI access for physicians that are overseen by physicians. It's huge.
I think the implementation of AI for medical scans or whatnot or whatever you're talking about, I think that's great, and I want to do that. Yes, it's a great tool because I've heard of this AI machine that could find breast cancer before any of the traditional scans could.
Right.
That's what I want AI to do.
Well, it's a tool, but it makes mistakes.
Right.
It just does. And I've seen it happen before, too. And so you always have to double check and go back through it. Physician oversight is key. Physicians have got to remain in charge and make the ultimate decisions.
Yes.
That's the deal.
Yeah.
I agree. It's
just
a tool.
Well, just like you guys. So, you run a large business, and if you're using AI for something, you've got to double check and make sure what you're putting out there is accurate.
Yeah,
it's
the AI is not running the show here.
No, exactly.
You're right. Like the Google AI overview, when you do a Google search, like sometimes that information isn't accurate. So, you could say Google's not even doing its own.
Well, you know what? We could.
You always got to double check.
We won't go down that rabbit hole today.
Double check. But you can't believe everything, and computers will make mistakes, and so will people. But the important thing is to have oversight and to double check, and always a set of eyes, human eyes would be great.
Yeah, exactly. But my point was simply we try to stay on the cutting edge and introduce as much into our practice as we can that's going to help our patients.
Yeah, he's not running away from IA. He's riding the wave.
Exactly.
He's on the wave. He's not letting the wave smash into him. But no, you're right. That's what a lot of people are trying to run away. But you're really have to see how you can accept it, and because it's going to be here, so get on that wave.
I agree.
Ride it, whatever the industry is, because it's going to smash you if you don't.
The thing is, remember being a kid and going to the library and having to do a research paper? It would say, literally, you can pull up in 30 seconds what used to take a week.
I know. I used to remember when you had to do a topic and everybody in the class had to do the same topic, and the book would be taken out.
Right.
I kind of miss that slow pace, though.
No, I know.
Well, that too.
There's definitely some nostalgia to it, but
absolutely.
But being able to pull up information is
adaptation, as I tell people all the time, like social media, use it as a tool, not a weapon.
Yeah.
But I will say, I don't like to wait a week for medical results. So if AI could definitely speed that up, I think that's wonderful.
Well, we do it manually because we, in our practice, this is a really good example. We get results usually before the patient, although with laboratory studies now you can often have lab access and that type of thing.
Yeah.
But as soon as we get the results, we upload them to the patient chart after we review them and send them to the patient.
Yeah.
It's that simple. Very easy.
Nice.
So the waiting is not like it is in many, many larger practices.
Mm-hmm. Right.
Yep.
All right. Dr. John Hayes still accepting new patients?
Yes, we are.
Yep. All right. Get in touch with him. You heard you heard what he does and what he can do. And again, transparency. You talk about costs as well. That's a big thing that people say they like as well, is being able to know exactly how much is this going to cost.
Exactly.
Yeah.
No surprises.
No surprises.
So that's a big key. DrJohnHayesJr.com. JrMD-DPC-NeuropathyDR.com. Call or text him 781-659-7989, 781-659-7989. Dr. John Hayes Jr.
Thank you, Doctor.
Thank you, Beth. Thank you, Rob.